The 4th annual UCSF Digital Health Awards seeks to find the most impactful and disruptive digital health companies. Out of the 1,000 plus submissions, only a select few have become quarter-finalists.
The member enters the Solera experience through an activation campaign. The campaign was likely branded for the health plan and messaged how the person's insurer will match them to programs at no charge to them for a healthier self. The experience can exist as a standalone white label funnel, fully embedded in the payer's portal, or as a bespoke branded experience. Our matching has driven superior results for our diabetes prevention program than CDC national benchmarks and published studies of other solution vendors. Which makes sense. Condition management is personal, so aligning clinical with behavioral needs helps give the individual their best shot at success.
Hear in their own words why they should win.
Hi, I'm Mary Langowski. I'm CEO of Solera Health. Our mission is to change lives by connecting consumers to the health solutions that work best for them. We're a digital health platform. We curate networks of point solutions and community-based providers to offer a range of condition solutions to consumers, including tobacco cessation, weight management, diabetes prevention, diabetes management, musculoskeletal, mental and behavioral health, just to name some of the areas we cross. We then match members to their best fit solution, so the consumer gets matched to where they're most likely to be successful. We look at their acuity level, how severe is their condition, but we also look at their learning style and, importantly, their preferences. Where do they want to receive care and how do they want to receive care? That means they're more likely to be successful and engaged at the end of the day. We partner with point solutions to help them improve their performance, and we pay them on a value-based payment infrastructure. So we make everybody in the system more accountable to clinical outcomes. And we partner with payers and employers to really streamline the vast ecosystem of point solutions. And through one single contract and one single IT integration with Solera, we make it much easier for payers and employers to offer a range of solutions to their consumers, but also for them to manage population health and know what's working and what isn't working for their population. We provide data and insights and accountability that otherwise would not be there. So Solera is in a really exciting space. We know that consumers want to receive their care out in the community and digitally. And we know that what's driving healthcare costs are these many things that are preventable and that are happening outside the traditional four walls of the system. Solera is there to help pull all of the pieces together and streamline the system and make it easier for consumers, our point solution partners, and payers and employers.
With the complexity of today's HR and benefits ecosystem, employees are feeling overwhelmed and uncertain. And in the era of the employee, they're looking to their employers for help. Our enterprise employee experience platform, Alight Work-Life, delivers that help. How? By using personalized recommendations and content surfaced by robust data and AI, engaging employees and helping them make informed, confident well-being decisions, all in one centralized, mobile-first HR and benefits experience. With over 30 million users and dependents and more than 200 million interactions, we continuously connect data points from enrollment, retirement savings, health claims, payroll, and more to enhance our AI capabilities and bring relevant, actionable content to the right person when they need it, where they need it.
Hear in their own words why they should win.
I'm here to talk about our Alight Total Guidance solution, an expert-led clinical guidance and healthcare and well-being navigation service that drives better engagement and simpler, smarter decisions for employees. Our solution is different because we have the ability to manage across benefits, payroll, wealth management, and healthcare navigation with our platform Alight Work-Life and our dedicated health pros and medical allied teams. Alight is unique because it has the highest rates of engagement and data that no other benefits administration, healthcare navigation, or payer has today, and therefore we are able to identify employee needs much earlier in the journey than anyone else. Alight Work-Life is our digital front door, that single entry point that ensures data-driven guidance and a simple, seamless experience. We leverage rich artificial intelligence and machine learning capabilities to personalize recommendations that enhance each individual's health and well-being and to navigate to resources that are non-clinical and clinical depending on the need. Additionally, Alight's dedicated health pros and medical allies will further optimize their health and well-being, improve healthcare literacy, and assist with treatment decision support for any and all conditions. We ensure the best possible care is delivered end-to-end through our Clinical Collaboration Center that enables medical allies to optimize the point solution ecosystem and payer interactions to drive outcomes. In summary, the Alight Total Guidance solution is uniquely positioned to help employers optimize the value of the benefits offered to their employees while improving the health and productivity of their workforce. And we will measure and guarantee to lower total cost of the benefits offered by employers. I believe Alight should win because we are best positioned with our technology, solutions, and scale to help today's employees make more confident decisions around their health, wealth, and well-being every day and in the moments that matter most.
Hear in their own words why they should win.
Hi, I'm Chris Mahalik, CEO of Virgin Pulse. First and foremost, I want to thank the UCSF team for considering us as a finalist for this year's awards. We're thrilled to be taking part. I want to spend just a minute on Virgin Pulse and tell you why I think what we're doing is so unique in the marketplace. Today, we're serving 6,000 companies and 14 million members on our platform. Each and every day, we're trying to help those members make better decisions about their healthcare. We want to show up for them in the moments that matter most, when they're trying to form a new preventative health habit, when they're trying to make a decision about acute care. We want to be there for people as they're forming new habits. 80% of people will abandon a new habit in the first 30 days. And we think the combination of incentives, a digital platform, and coaching will provide the kind of support somebody needs to make better decisions about their care. Our clients care a lot about the physical, mental, and professional health of the people that we serve each and every day. They want them to come to work, to contribute, to be engaged, and to be productive. And we think when we address the whole need of an individual, that we'll put them in a better position to contribute to their organizations. What we want to be is the one-stop shop. We call it being the home base for health for our clients and their members. We want to be the place where people go to get the kind of advice, content, and incentives they need to take them on the next best step with respect to their healthcare journey. We believe the combination of digital and high-touch capability is critical to making that happen. At the end of the day, I said we're in the behavior change business, but what we really hope is that people's lives will be changed for good because of our platform, our capabilities, and our people who are serving our members each and every day.
Our fertility support includes educational content, clinical care navigation, and unlimited telehealth access to experts like reproductive endocrinologists, urology specialists, nutritionists, emotional support experts who focus on fertility, and other specialists. Every fertility journey is different. That's why it's so important to have a map to navigate the ups and downs, financially and emotionally. With a worldwide network of vetted clinics and providers, telehealth support from Carrot experts, and personalized plans, Carrot removes barriers to care so members get the support they need. That means less stress for members and more successful journeys for couples like Alex and Cameron.
Hear in their own words why they should win.
Hi everyone, I'm Dr. Asma Ahmad, the co-founder and chief medical officer of Carrot Fertility. I'm also a UCSF alum as I completed my fellowship in reproductive endocrinology and infertility at UCSF in 2017. Carrot's approach to coverage is unique in that it enables employers to access fertility benefits with greater flexibility, transparency, and more predictable cost controls, while avoiding millions of dollars in unnecessary medical claims. Our team of medical experts ensures that all Carrot members receive the most recent evidence-based and high-quality education and care navigation to empower individuals to be better, more informed agents of their own health. My team continuously refines Carrot's unique algorithm so that every member receives a personalized care plan that fits their needs. Today, more than 200,000 Carrot plans are possible. All of this is customized based on scientific data, regional variations, and best medical practices on a global level, with availability in more than 120 countries. Personalized Carrot plans are based on a member's medical history to optimize outcomes specific to their diagnosis and journey, whether that's pregnancy, menopause, or something else. Working closely with Carrot experts can reveal paths a member didn't initially consider. For example, instead of starting by guiding someone to IVF, a Carrot expert may direct a member to try a less costly and less invasive option, such as an ovulation tracker, and provide resources on topics like nutrition and fertility. Helping members understand their options and guiding them towards appropriate care helps improve fertility potential, their pregnancy outcomes such as reduction in C-sections, preterm births, and complex hospitalizations, and also helps lower costs in the long term. If a Carrot member opts into a Carrot plan for menopause support, for instance, they will have access to one-on-one expert sessions or group sessions on a range of menopause topics.
Hear in their own words why they should win.
I'm Stephanie Telenius, CEO and founder of Vita Health. I'm here to answer 3 questions for you today. First one is, what is your company's superpower? Well, our superpower is the way we bring human providers and cutting-edge technology together. And in fact, we describe our technology as that it takes already great dietitians, therapists, coaches, endocrinologists, and gives them superpowers. And by using data science and machine learning to uncover patterns and anomalies, we are enabling providers to focus on making the biggest impact on their patients. Second question is, how do you differentiate yourself versus your competitors? Well, most people who have chronic conditions also have mental health conditions. Vita differentiates itself by integrating physical and mental health in one app. And we have best-in-class outcomes that are so predictable, we put 100% of our fees at risk. Now, you also have, why should you win a 2022 UCSF Health Award? Well, to have an impact in healthcare, you need to create a scalable platform that gets outcomes at sustainable costs. And at Vita, we have proven that we can achieve real scale and real medical cost savings of $150 to $200 per member per month. Thank you for your consideration today.
It seems like there are millions of solutions for working families these days. So why do they feel more, not less, overwhelmed when there's all of this new support out there? At Clio, we know why. We know that families are stressed by 1,000 little cuts. They've got a bunch of well-intentioned fixes, when what they actually need is a holistic solution. Something personalized, something trustworthy, someone, well, human. Someone who creates a space to share what's weighing them down and flooding their minds, and actually get them the help they need. That's why we pair families with a dedicated Clio guide who will lead them through all the growing pains of parenthood. From anxiety brought on by infertility, to how to get baby to sleep, to addressing bullying and mental health, to getting into the groove between work and home. And if a family's guide doesn't have the exact solution to a problem, they know the experts who will.
Pain is more than just physical discomfort. It's the fear of movement. The dread that an unexpected flare-up means calling in sick from work. It's the regret of missing out on time with loved ones. Pain doesn't care who we are or where we're from. It doesn't discriminate on the basis of sex, race, or social status. And neither do we. Kaya is a personalized digital care plan for pain management, uniquely tailored to your pain and ability levels. Physical exercise, relaxation techniques, education, personal care, and a touch of fun all combine into a harmonious pain solution. Kaya's approach helps you understand the root causes of pain and promotes lifestyle changes for your well-being.
Hear in their own words why they should win.
We're moving so many things away from other devices to the phone. We used to carry cameras, we used to carry keys, credit cards, cash. All those things are giving way to one device, and the ability therefore to deliver therapies through that device that people carry is really a massive differentiator. And so that's our vision, is that we can enable people to access these care anytime, anywhere. We've started with musculoskeletal, we now have COPD, we're moving on to long COVID, and over time hopefully we'll add additional digital therapies that meet the needs of our patients. What's incredible about the motion analysis technology that we've built is that it enables people to get real-time feedback on the exercises they're doing through the device that they carry with them 24/7. And so that means that whether you're at work, whether you're at home, whether you're traveling, all you need to do is take out your phone, lay it against the wall, and you can have clinically excellent physical therapy there and then. That is a tremendous differentiator and transformational for how people can not just access physical therapy, but live a life free from pain. And so as you think about creating the best environment for your employees, the ability to enable them, wherever they are in the world, to get the same high quality clinical experience through a device that they carry with them 24/7 is truly incredible.
Along the way, we realized the root causes of so many of the challenges that we were facing, the clinicians were facing, and our healthcare institution partners was that the way we connect with our workforce is fundamentally broken. We've created this mess of systems and services that don't really talk to each other, and it doesn't really work for the problems that we have. So we locked arms with some forward-thinking healthcare institutions and spent the past 3 years building what we think of as a new strategic operating system for the future of work and healthcare. And we call that WORKS. So work starts by bringing all of employers' labor pools, so that's short-term and long-term or internal and external, into one data-driven system. And from there, we give these systems the ability to create their own bespoke, flexible staffing program. So to give you some color, say you're using Works. First, your staffing environment's dynamic, to say the least. We integrate with your scheduling system and understand what are your upcoming openings and who in your local network might be best suited to fill them. So it could be someone from a float pool, a part-timer, a gig workforce, folks just looking for an extra shift here and there. And we'll intelligently distribute the shifts to the matching right people at the right time via a mobile app that they'll be enrolled in. And hopefully your local and less expensive labor pools will be able to take the bulk of your flexible needs, but just given the number of unfilled jobs, you're going to need to supplement with longer term labor. So our platform can directly connect you with a global network of long-term talent. And the system itself will handle everything from onboarding and compliance to approvals and payments. So make it easy to insource the entire program and avoid paying another service provider to push buttons. Mercy Health has been one of our key beta partners for this. And right now we're managing over 1,000 external clinicians, both international and domestic, and 9,000 internal workers to the program. We're still innovating with them, but by simply shifting the mix from travel and external labor to their own on-demand workforce, we've already been able to show significant cost reduction while maintaining fill rates.
They told me I'd follow in my mother's footsteps. She died young from diabetes. That terrified me.
I was in constant pain, especially in my feet. I didn't know if I was going to be able to carry on doing my job with the pain that I was suffering from.
I was diagnosed at 27 with diabetes, and shortly after that I was put on insulin. For me, that was scary.
They tell us all these things about what living with diabetes is all about.
What living with diabetes means.
But they're not true.
My job is to provide benefits and save the company money. I now have a life-changing solution for our employees and their families.
I'm not on insulin anymore, and it's a very big deal. Can't wait to see what's next.
I'm better at my job than I was 10 years ago. I don't deal with the constant pain, and I'm putting the young guys to shame.
This is the Hello Heart app. As you can see, it tracks your blood pressure using our Bluetooth-enabled blood pressure cuff. It tracks your cholesterol. These come from your electronic medical records. Just like with blood pressure, you can click on a number to learn what does that mean in everyday language that you can use and is actionable. You can also track your weight and your activity. And if you've got a connected device like Apple Health and Google Fit, they'll come directly in there. Don't forget to set up your medication reminders, the time you started them, when you're supposed to take them. And the most important feature of the Hello Heart app is the digital coaching. It's on-demand 365 AI-driven digital coaching. You can mark coaching as helpful and not helpful. You can get insights from other members. You can watch videos and other curated content to keep you going on your journey for improving your lifestyle. Don't forget to become a perfect user by setting on all your notifications, including your language and your location.
Hear in their own words why they should win.
Hi, I'm Jen Roberts, the Vice President of Employer Health Strategy at Hello Heart. Hello Heart's superpower is our supervision. We can see what others can't in the market and take action and drive continuous innovation in our app. We differentiate ourselves from our competitors in that we are the only company that focuses exclusively on whole heart health, including hypertension, cholesterol, and a regular heartbeat. If you want to improve heart health, you have to work on the pump and the pipes, and we're the only company that helps people manage their cholesterol or their pipes. Our results are peer-reviewed and shown to work, both financially and clinically. We've published with UCSF, in the Journal of the American Medical Association, the Validation Institute, and most recently, the American Heart Association. And our clients choose Hello Heart because we're proven, engaging, and easy. Why should we win the Digital Health Award for 2022? Because heart disease is the #1 killer of Americans and the #1 healthcare cost. because women are 2 times more likely to die of cardiac events than men, because people of color are disproportionately impacted by heart health. Hello Heart supports health equity in all these areas. And we've achieved amazing results in the past 12 months, including significant product expansion with the addition of the cholesterol to our hypertension platform, and our dot-to-dot connections, helping members link back their behavior and lifestyle choices to their clinical results, as well as supporting health equity during the pandemic and beyond. Heart disease is at epidemic proportions in this country, and this award could really help raise awareness. Thank you for your consideration.
In their own words, why they should win.
Vori Health is an award-winning, nationwide, virtual-first musculoskeletal practice that treats patients in a holistic way with evidence-based care. We are tackling what is a big challenge for employers and a dirty little secret in medicine, which is overutilization of spine and orthopedic surgeries. My co-founder, Ryan Grant, and I are both surgeons, and we knew there was a better way, the Vori Health way. Using our nationwide unique care model, we connect patients with truly integrated care teams consisting of an MSK specialty physician, a physical therapist, and a health coach, and we pull in nutrition services as needed. This clinical team manages the initial assessment of the patient, integrates behavioral health, and creates a holistic care plan that includes an actual diagnosis and helps to coordinate all aspects of care for that patient. As the only nationwide musculoskeletal medical practice, we can treat the broadest set of conditions ranging from pain to bone health. We offer significantly more services than others in the market. Our model is highly effective, with over 70% of patients improving in as short as 3 to 4 visits. We know that 90% of MSK conditions can be effectively treated non-surgically, making our model so applicable. And for those who need surgery, we help them find a great surgeon. Our solution is cost-effective. With our non-operative conservative pathway, we can produce up to a 4-to-1 ROI through validated actuarial claims analysis, and our surgical optimization pathway, a 13-to-1 ROI. We're very proud of how far we have come as a company, but our best achievements are measured one patient at a time. At Vori Health, we are transforming the delivery of spine and orthopedic care to be truly value-driven and patient-centered. Thank you for helping us empower humanity to lead their healthiest lives.
I've heard people say opioids are addictive, but I didn't understand what that really meant. Some days, I don't even recognize myself.
Most nights I fell into the same routine. I drank late and woke up feeling terrible.
I know I need to stop. I can't do things I love, and that scares me.
Millions of people suffer in silence with addiction, costing employers over $81 billion annually. Quit Genius is the world's first digital clinic dedicated to helping people conquer their substance addictions. We are the only clinically proven telemedicine program to virtually deliver medication-assisted treatment for multiple addictions. Members can work through highly personalized cognitive behavioral therapy on their own time. Adherence and outcomes are measured through a set of remote monitoring devices, while certified counselors and coaches guide members through every step of their journey. Quit Genius, helping our members be the best versions of themselves.
Hear in their own words why they should win.
Quit Genius created and dominates the category for integrated substance use care. We're recognized as the world's first digital clinic for treating nicotine, alcohol, and opioid addictions, and now provide the most innovative and effective treatment program in the nation. This unique program is built on the evidence-based principles of medication-assisted treatment, and it combines behavioral therapy with FDA-approved medication with industry-leading outcomes. Our program follows guidelines utilizing cognitive behavioral therapy as part of a holistic approach to combat addiction in the workplace. Now, this helps improve the lives of members by empowering them to conquer their addiction and regain control of their lives. We deliver comprehensive care, starting with 24/7 access to drug and alcohol counselors, quit coaches, and prescribers via telehealth and text, supported by our on-demand app-based program. Our program is built on a decades-long foundation of scientific research and supported by ongoing studies. And providing the best care for our members is paramount, which is why we've invested heavily in clinical research, now with 9 peer-reviewed studies, including a randomized controlled trial that makes Quit Genius the most validated digital addiction program on the market. 40 million Americans have a substance use disorder, yet fewer than 10% of them get access to the help that they need. Quit Genius is highly deserving of the UCSF Health Award because of our world-first solution. We are addressing this national crisis and demand for effective solutions by solving the challenges of access, cost, and efficacy. And we've already helped over 750,000 people improve their lives and quit their addictions. But we're just getting started. Our mission is to help 100 million more.
The Capital RX member app offers a modern healthcare experience for our members. Through advanced technology, we remove barriers to care and connect users to their pharmacy benefits information from anywhere. All technology at Capital RX is created to be as simple and easy to use as possible, and the member app is no different. Our proprietary technology allows us to seamlessly integrate with Judy, our enterprise pharmacy platform. This offers members access to details like real-time accumulation totals, updated claims history, and test claim information on the spot. On the home screen, members can view deductible, out-of-pocket, and plan spend information immediately after logging in, and a click of a button offers an explanation of what each section means for them. Toggling between individual and family plans is simple, giving members the ability to make decisions for themselves and their families from one central location. A digital pharmacy card is also conveniently located on the home screen, so members can share it with their pharmacist on the go at any time.
Hear in their own words why they should win.
Our mission is to change the way drugs are priced and patients are serviced to create enduring social change, because every American will fill hundreds of prescriptions over the course of their life. To reduce prescription costs in the United States, it required 2 initiatives from our organization. The first was to create a public ledger for prescription transactions. We call this a clearinghouse model, where we allow the buy side, the employer and patient, and the sell side, the pharmacies, to freely communicate on price. We do this with a flat administrative fee, and we do not encumber prescription prices. This means every patient and plan receives the same price, but more importantly, we deliver it through an agnostic network of pharmacies. So retail, mail, pharmacies across the United States, including health systems, can freely participate in our network model. We deliver this model through a modern administrative platform. We call this Judy. Judy is short for adjudication, and she's the brains behind our organization. The systems of the United States that are running prescription transactions are 20 to 30 years old and have traditionally only addressed the thin middle layer of processing claims. Judy is a true enterprise health platform and contemplates every workflow a pharmacy benefit administrator must contemplate, from underwriting to plan setup to claim processing to drug utilization review, clinical workflows, as well as network administration, billing, and reimbursement. By doing this, we're able to reduce costs for for our customers by over 80% on the administrative side, and this means lower cost prescriptions for the patients in the plans. The results of Judy speak for themselves. We are the fastest growing PBM and healthcare company in the United States. We manage over 1.4 million lives with 150% year-over-year growth. We have a net promoter score of 96 on the client side compared to 14 net promoter score for the industry. We have a net promoter score of 68 in the call center for our patient compared to 7 net promoter score in the industry. We couldn't achieve these results for Judy, and we are truly achieving our mission to change the way drugs are priced and patients are serviced to create enduring social change. Thank you.
Hi, I'm Alex Newbold. I'm the Chief Administrative Officer here at Wellthy. Wellthy is a market-leading caregiving support solution, revolutionizing the way families care for their loved ones and themselves. Our unique service model matches employees to dedicated care coordinators who provide a hands-on support that is tailored for their family's specific circumstances. Behind the scenes, we have care advisors who provide subject area expertise in anything from housing, in-home care, financial issues, and more. We pair this unprecedented level of human support with best-in-class digital experience. Our care dashboard offers comprehensive resources, planning tools, and Wellthy Community offers a social space that connects caregivers to others who are going through the same thing. At Wellthy, our superpower is uplifting caregivers and empowering them to be their full selves at home and at work. We go far beyond care management to handle any of the administrative or logistical tasks of caregiving and actually get things done for families. We deserve to win the UCSF Health Award because we're solving an urgent problem. There's a massive caregiving crisis in the US. About 3 out of 4 employees face some sort of caregiving responsibility, but lack the support they need to manage it alongside their jobs. As a result, companies are losing $38 billion each year due to lost productivity, absenteeism, and retention issues. Wellthy's solving this urgent problem, not only as a market leader in caregiving support benefits, but as the ones who are shaping the category and its solutions. We've gained traction with some of the largest, most well-known employers in the country, including 26 Fortune 500 companies and more than 1.2 million employees that now have direct access to Wellthy. As employers think about attracting and retaining talent and what it takes to keep women in the workforce, it will be imperative to offer employees the support they need to care for their families at home so they can bring their best selves to work.
Hi, I'm Anna, a health guide with Transcarent. We're here to bring transparency, simplicity, and a bit more humanity to health and care. Transcarent is the best way to access all your healthcare needs. A simple experience designed around you, with access to a doctor in 60 seconds, 24/7, or help scheduling a visit with a local, high-quality provider. We'll find you the lowest cost medications for home delivery or local pickup, help you receive urgent care services from the comfort of your home, and even consult with expert providers on your treatment plans. You and your loved ones deserve a better way to get health care. Here's how it works. Access your care the same way you text a friend, book a ride, or stream a movie. No hassles, no surprises, and a whole lot more affordable. A health guide is your dedicated point of contact. We're here to listen and lead you in the right direction, to answer questions, find information, or even coach you on any of your health goals. If you prefer to do things yourself, just go to the app, day or night. Simple questions to serious concerns. You've got everything you need at your fingertips.
Hear in their own words why they should win.
Here at Transcarent, we have built a new, different, and better health and care experience that puts you, the consumer, back in charge with high-quality care, transparent information, and trusted guidance in as little as 60 seconds, 24/7, from the palm of your hand. And this experience has been redesigned for all the stakeholders in the ecosystem, from the employer, who's the payer of the care, to the provider who delivers the high quality care, to the ultimate consumer. And it starts with our deeply integrated, seamless, scalable, and secure healthcare platform that enables this connected direct care ecosystem for all the stakeholders unlike they've ever seen before. And we are fully aligned with the employer, where we go fully at risk, where we don't make any money until the employer saves money, and they ultimately see value, both in terms of cost, care, and ultimately a superb member experience. The members get access to care within seconds, hassle-free, day or night, 24/7. And we eliminate the cost burden of copay and coinsurance that troubles most consumers today in care. And as a result, the feedback that we get is, this is the best experience I've had in years. I had no worries how this would work or how much it would cost. You made me feel at ease. Everyone should have access to a service like this. And it's best when we hear, you've helped me more in the last week than I've been helped in over a decade. The employer gets an enhanced benefit with one unified experience, resulting in high employee satisfaction, better health, lower costs, and less administrative burden for the employer. And this experience is delivered for their entire population, no matter where they live or how much money they make. TransCare directly connects our employers and their employees with high-quality providers across the country and in their local geographies. What our superpower is truly bringing transparency, simplicity, and a little bit more humanity back into healthcare as we think about the experience that our members are consuming today and expect not just today, but into the future.
Imagine if healthcare was built specifically for you. Just imagine how extraordinary that world would be. You don't have to imagine. Maven is building healthcare for you. Because at Maven, we believe everyone deserves access to high-quality healthcare.
Hear in their own words why they should win.
Hi, I'm Kay Ryder. I'm the founder and CEO of Maven. I started Maven in 2014 because there were so many gaps in care along the deeply personal family journeys that we all have. I now have 3 kids that I've had on the Maven platform. And today, 8 years later, we work with, as a business, nearly half of the Fortune 15, and we cover nearly 15 million lives to help people through the fertility and family building journey, the pregnancy journey, parenting, and beyond. The secret to our success, that's the question here, I think boils down to one word, it's access. And so, that was really why we started in the first place. And access to us means a lot of different things. It means access to care when you need it, whether it be the weekend or the middle of the night. It means access to care at the right time with somebody that you trust. It means access to appropriate care. It means access to care from somebody that shares your lived experience, and that access to different types of care. And so I also have an incredible partner that helps design some of this access to care in Neil. So I'm going to turn it over to him as well. Do you want to share a few words?
Yeah, sure. We believe that the well-being of mothers is a bellwether for the well-being of society as a whole. And that's why every injustice in society shows up in the well-being of moms, whether it's inequity of race or gender or geography. And I'm just thrilled to be at Maven because we can use digital health to correct some of those inequities by providing access, as Kate says.
Join us on November 14th for our grand finale at Health in Las Vegas to see the winners crowned.